Is stigma still a thing?
I, I would say absolutely it's still a thing. Particularly, I just mentioned the issue about women. And really, I really didn't do it justice because it's really a scarlet letter for many Black women. It disrupts the relationships with their churches in many instances with family members. You know, in 2021 now we're in, there's still places and where people will ask you to eat off of a paper plate and use a plastic fork and then throw it away after you've eaten because they don't know that you can't transmit HIV that way. Talk about stigma as if you get a paper plate and a plastic fork and nobody else does. So it's very much real. And I think similarly for men who have sex with men, you know, and some of the listening and the work we did in Jackson, I think, which was really a lot of kernel of some of that reporting that happened, is that they described it three ways. They said, as a Black male in the South, in the Deep South, that's already one strike against you. As a gay man, that's the second strike, and you get HIV, and that's your third strike. And so I would say, absolutely, we've come a long way because I think you think about the visibility in popular culture, people say, well, there's Pose and there's this and there's that. But on the day-to-day basis of people in local communities, I say we're still facing stigma.
Anybody else want to chime in on that?
I agree 100%. I mean, you know, Mark characterized it perfectly. There's no question that stigma still exists with HIV, and unlike, you know, other diseases where over time, I mean, you remember sort of in the 50s, they used to whisper about cancer, and now that's, you know, people recognize you didn't have to, you don't do something that made you get cancer, and it's not something you have to whisper about. And we're still whispering about HIV. You know, I've always said, I wish we were talking about HIV at our Thanksgiving dinner table, or, you know, just so that we normalize it as a part of the world that we live in, and that people are, as Tyler described, you know, thriving despite HIV. And so if folks can be open about it, the fact that they're living with HIV, then it makes it less stigmatized that that you're going to get a test, or that you're on something to prevent HIV, or that you're on treatment for HIV. And so it does require that we're talking about it more. And then I just to one point is one of the questions that came up around HIV criminalization. You know, there are still states in this country where having sex with someone, if you're HIV infected, is potentially criminalized. And that's a ridiculous thing, but it does exist. But who gets prosecuted for that kind of stuff? Who gets arrested for that kind of stuff? Black folks disproportionately. And so, you know, that's, again, we're talking about topics that can be, you know, the subject of articles. HIV criminalization is certainly one that doesn't get the kind of attention people to understand about it. And those types of laws should be relics, but they're not.
I think there's also laws that aren't explicitly calling out HIV, but are being used against people living with HIV through a very nuanced way to criminalize people based on their HIV status. So, and I think a really great story would be an examination of states that that really are kind of stuck in this moment of HIV exceptionalism, right? They early on wrote laws in their states surrounding HIV, and they've never been updated since 1985. And now people are able to dig in and use that as a weapon against people living with HIV in a they said, she said, he said scenario. And it's just a dangerous road when we aren't doing the due diligence to make sure that laws are reflective of the current time that we're living in.